February is Black History Month, and as this year's theme is Black Health and Wellness, we asked Dr. G the struggles and triumphs African-American doctors go through. Dr. Robert Gillespie, or as his patients call him, Dr. G, is a cardiologist at Sharp Medical Group in San Diego and has worked in the medical profession for almost 30 years.
When you have the white coat on, I always tell people with a white coat on, I never have the real problems. It's when, particularly as a younger person, before the daily interactions we have outside of the white coat. When people don't know you're Dr. Gillespie, that creates certain levels of stress.
He's explaining how becoming a doctor was always his destiny, but being a Black kid from Indiana in the late 60s with such strong aspirations came with barriers.
I have to tell you, there have been many barriers. When I grew up in Indiana, in Gary, we were just becoming a racially diverse part of town. And as a result, there was a lot of friction between Blacks, whites, and different racial groups. And I pointed this out in a number of my presentations where the racial tension was very steep.
From discouraging remarks made by professors, neighbors, and colleagues to a system built on having larger roadblocks for minorities.
If you look at statistics for African Americans nationwide, we make up about 13.5% of the population, but we make up about a 5% of the physician pool.
In spite of it all, he persevered, showing other young, aspiring doctors that he never let race get in the way of the long work hours and sweat he put in medical school, promoting that whites, Blacks, and all other races can become doctors, and adding that a prestigious title like his is earned by the amount of work you put in, not by the color of your skin.
One of the things that always keeps me pushing, no matter what's going on in my life, is the beauty of medicine and the impact you can have on those around you.
But in 2020, an even larger roadblock fell onto Dr. G and every other medical professional. The coronavirus pandemic overwhelming hospitals and traumatizing those on the front lines.
It was scary to even go into the hospital because we didn't know what to expect. We're seeing people coming in there deathly ill, dying. We couldn't do it. In many cases, we had very little knowledge, didn't know what to do.
Dr. G says a cardiologist mainly focuses on monitoring and testing a patient's heart. But with the surge of the pandemic, his duties quickly changed. And if that wasn't stressful enough, medical professionals are now being attacked by misinformation.
Part of the reason that African Americans and Hispanics or Latinx communities have not done as well has to do with a level of interaction with healthcare, the mistrust for healthcare, the lack of necessarily having people who look like them caring for them. That does matter a lot to historically disadvantaged populations.
That is why Dr. G has taken matters into his own hands and continues to educate minorities in San Diego's underserved communities, making sure that everyone understands the dangers of this virus and reaffirming how the vaccine reduces risks. For CBS 8, I'm Regina Urrieta.